Morning. Can you guys hear me? If you can hear my voice, clap one time. Thank you. Good morning. Our speaker, as talented and intelligent as he is, has a very, very low speaking voice. So he's asked that I ask, even the shy among you, if you could move forward, we would greatly appreciate that.
If you don't move up, I will call on you.
So this is the first time that request has actually yielded action. So I think it's the laryngitis that was the selling point. Is that what it was?
Did it work on everybody?
Great.
Perfect.
Great. Good morning. My name is Dante Allen. I'm the Senior Communications Officer in the Office of Health Equity. Thank you both for those of you who are here in the room and those who are joining us via WebEx and over the telephone to participate in our monthly speaker series. I know that it is often a challenge, especially for the first time since we've been doing this event, to ask you to take time in your morning to come in and listen to one of our speakers. And so I appreciate you, I salute you, I encourage you to encourage your colleagues to participate in person when they can, and if they can't, we'll be posting all of these on our website so they can attend. If they can't attend, they can go to the website, or if they can't tear away from their desk in order to attend, they can participate via WebEx. I did want to give you a few updates. Jamal Miller, the Deputy Director in the Office of Health Equity, couldn't be here today. He's in Colorado, I believe, at the National Alliance of Mental Illness, their annual meeting, and so he is making the rounds. The other thing that I wanted to give as a brief reminder, especially for our folks on WebEx, the microphone is an essential tool. One of the things that interrupts the microphone are all the various wireless device signals that are in the room. So if it's at all possible, we implore you to turn those off while you're in the room. I know that can be a challenge for those of you who are either on call at work or in your personal lives. But if you're able to do that, it would be greatly appreciated by the folks that aren't here, that are listening via WebEx. I hope you saw last week we put out our OHE newsletter for July. It's a monthly newsletter. This one was a little different because it had a theme and it focused on the same topic that we'll be focusing on in today's presentation. And we hope that will be a trend as we have speakers. We'll take these deeper dives. And if you haven't figured it out yet, there is a rhyme and reason to how we are putting these speakers together. The idea is that we get comfortable about talking about the causes of the causes, those things that are the social determinants of health, because it would be great to say, well, CDPH is focused on the largest population, and then OHE will focus on health equity, but it won't work like that. We all have to have a very similar mindset, and these are to be those first conversations on how we get there. Things continue to move along in OHE. Next month, we have another featured speaker. I'm sure that you will enjoy him. Probably not as much as you will Dr. Handler, but he is a great speaker in his own right. George Halverson, he's the chair of the First Five Commission and was the former chairman and CEO at Kaiser Permanente. He served for about 11 years in that role, so he has lots to say about equity, healthcare, and even the earliest years as far as leveling the playing field for childhood development and long-term health. So that's in August. It'll be toward the end of the month. I think it's the 26th. There were flyers up top if you have them. Let me see. Also later this month, Jamal will be a featured presenter on the Healthy Communities Data and Indicators Project. And this will be at a joint convening of the National Association of Black Journalists and the National Association of Hispanic Journalists in Washington, D.C. He'll co-host a panel with Pamela Gentry of the Federal Office of Minority Health. Let's see, for the California Reducing Disparities Project, that's the major initiative within the Office of Health Equity to issue $60 million in grants and contracts to reduce mental health disparities. That work continues. The money is going out the door. We've already publicly announced the technical assistance providers and the pilot projects, and we hope to soon publicly announce our intent to award on some of the capacity building pilot projects. There's also lots of work going on in our health and all policies, and our climate and health team. If you haven't heard, they've rebranded themselves, and they are now known as the Climate and Health Equity Team. So lots going on in the Office of Health Equity. If you have any questions, please let me know. For those of you online, you can submit your questions at any time, and we'll be taking a running tally of those. And I think we announced at the last speaker series, if we didn't have enough time to get to all of the questions, what we're doing is we're compiling them and asking our speakers to give us some answers after the fact, and we'll send those out via that sign-in list that you guys participated in. So on to today's speaker. Is Dr. Eric Handler, and I like to consider him a friend. I met him within my first week of being a part of the Office of Health Equity, and Jamal was like, there's this guy that you just have to meet because he is a rock star, and I agree with him wholeheartedly. He is, in addition to being a very talented physician, he also has his master's in public health. He serves currently as the public health officer in Orange County, which I'm sure you know is one of the wealthier counties in California, home of places like Newport Beach and Laguna Beach. And I don't know how many of you have ever flown into John Wayne Airport in Orange County, but they're wealthy enough there that they take off differently than any other airport in the country. I'm serious, you take a very steep angle where you feel like you're going almost straight up, and then once you get to that right height, they cut the engines and you sort of glide out of town. I'm not joking about this. This is very real. It's for noise pollution for those folks that have those wonderful beachfront properties. They don't want to hear planes flying in and out all day. And they say it's perfectly safe, but I would wonder why they won't do that everywhere if it's so safe. But even though the vast wealth that exists in Orange County, they still rank in the top 10 in the nation for food insecurity. And so Dr. Handler, who has been with the Orange County Health Department since August of 2006?
10 long years.
10 long years. Came up with an idea one day and said, what if I could end hunger in Orange County? And not only was it a seed, he decided to fertilize it and grow it, and it's grown into Waste Not OC, which is a phenomenal program that I'll let him talk to you more about. But I will say that when I did meet him, my first inclination is, how can we spread what he's doing across the state? And we've been looking for opportunities to bring him here to talk to folks ever since he's been on his own parallel track, spreading this sort of county by county so far. Maybe a couple of cities are involved too. But the idea is it's gaining traction, it works, and there's something that we all can learn from it, which is why we invited Dr. Handler to be here today. Just to give you a little bit about where he's been previously, he was the Deputy Secretary for Children's Medical Services in the Florida Department of Health, and he was the Chief Medical Officer for the Florida Department of Children and Families. Amongst other things, he is quite possibly the greatest evangelist of public health that I've ever met, and I'm very happy to welcome him here today, Dr. Eric Handler.
Thank you. Thanks, Dante. Can you turn that on? Have you turn that?
Keep it on.
Okay, that's okay. All right, so first of all, you don't have to take any notes. All right, so put your pens, papers away. That's number one. Number two, everything that I talk to you about is on our website. So you really just have to listen. And number three, if I catch you dozing, I'm going to call on you. All right? So you need to pay attention. So let's talk about a couple of things. How many of you have been in a restaurant and just wondered, look at all that food that's being thrown out? Raise your hand. How many of you did something about it? Raise your hand. What did you do about it?
I took my leftovers home.
Okay. What did you do about it? Okay. Why didn't anybody else do something about it? Wait. Oh. What did you say?
I didn't know what to do. I didn't know what to do.
Okay. Did you think it was important?
Sure.
Okay. How about somebody else? Hold on. I'm not sure this is working, but we'll get it.
I'm asking for the first question, I asked them to reduce salt and less fat for my plate.
That's a completely different talk. But
So very first time, for the very first time when we go to the restaurant, they put everything on the plate, so I want to make it different.
okay. Somebody tell me why you didn't do something about it. I think this is working. Here you go.
So I didn't do anything because I thought what I would do wasn't big enough. So the problem is so huge that what could I do with my very little minimal?
Did you all hear that? Okay. That's what I was looking for. Okay. She actually was a plant. All right. So the problem is so huge. Social determinants of health, right? Poverty, unemployment, housing, hunger, racism. People talk about it all the time. I can't tell you how many presentations I've heard about social determinants of health. And each time I walk away so depressed because you're giving me this bleak picture, but you're not giving me any solutions. I'm going to give you some solutions. I'm going to give you some strategies that you can apply yourself within your community, within your city, within your county. So I'm going to give you some of the tools. But what's interesting about this social determinants of health, most people are fearful of dipping their toe in the ocean and taking a step forward to address it because it is so huge, right? So what's your name? Dante. Dante? Another Dante. Dante, read this loud for me.
There is nothing new about poverty. What is new is that we now have techniques and the resources to get rid of poverty. The real question is whether we have the will. Martin Luther King Jr.
Okay, so what does that mean?
That we have known for quite a few years what to do. We just aren't doing it.
Why?
Because it's huge.
It's huge. But they said we have the resources. All we need is the will. All right? So let me give you a couple of points here. Number one, this has been the most political issue I've ever been involved in. And I'll tell you why later on. That's number one. Number two, this has been the most successful initiative I've ever been in because it consists of individuals that are passionate. They want to see this happen. They want to make this happen. So I'm going to take you on a journey, my story and the story of the coalition, the Wasteland OC Coalition. Just sit back and enjoy it because this has been one of the most enjoyable journeys I've ever found myself in. Okay, so can we dim the lights? Is there somebody up there? So every time my project manager sees this video, she gets all choked up. So can we show this video?
What's your favorite food ever?
Can you all hear it?
Mac and cheese, pancakes, and popcorn. My dad's steak pizza, so good. What food do you dislike most? I hate cheese. How you doing? Spinach. Tomatoes. I'll eat it at home. What do you do when someone gives you food you don't like? Fails and it turns out cold. I'll say, it was bad. It was that way. Because it was gross. Why would I want to eat it? Did you know that 1 out of every 5 kids doesn't have enough food to eat? 1 out of 5. I didn't know it was in Atlanta. Well, don't sing. That's a lot of kids. It's kind of unfair because some people have too much stuff and some people have too little. For me, I always do too much. And if that's a meal that I'm missing, I would feel very disappointed. Makes me feel like, what are you going to do to fix this? What is something we can do to help fight hunger together?
So over there in the wall, there are tons of ideas, and you want to add your idea to the wall.
Kid could think, oh, that's not possible, or oh, I'm too young to do this. But it is possible, and you're not too young to do it. Donate money as much as I can. Make Thanksgiving every year. We should all get a group and try to find the foods that would be easiest to give. And we can take the food to homes where they don't have food. That's a small way to have a big impact. Post video about children not being able to eat. Everyone brings canned food, and they build a big fort, and then they donate all the canned food. And then they have everything for free. If there was a machine that could make food, my machine would change. It turns on 5 kids being hungry. The tiniest ripples make the biggest waves. If all the kids in the world got together and did something big, they could impact the whole world.
Pretty powerful video, isn't it? Can we hit the lights, please? So, it's such a big issue. We can't do much about it, even though there are 16 million children in the United States that don't know where their next meal is going to come from. So I'm going to tell you how I got started doing this. Okay? I'm a pediatrician. I'm a pediatric rehab specialist. I never dealt with the homeless or hunger. So I came to Sacramento, and what I'm going to tell you is actually a true story. Came to Sacramento. I didn't have a meeting until the afternoon, so I decided I was going to go downstairs to the hotel and get some breakfast. But, being who I was, I decided, why should I dress up? Why should I shower and shave? Because my meeting wasn't into the afternoon, right? So I'm wearing a shirt, sweatpants, tennis shoes, and as my wife would say, you look like a bum. That's number one. And number two is I'm going downstairs to get something to eat. I hear this voice on my shoulder. Are you out of your mind? You're going down dressed like that? And of course it was my wife's voice that I was hearing. But I go, what are the chances of somebody bumping into me that I would know. So I sit down, I'm eating breakfast, I got my iPad, my face is down. 10 minutes into my breakfast, I hear, "Hi, Dr. Handler." And I went, "Are you kidding me?" And it turned out to be the director of the OC Food Bank. And I had a conversation for an hour with him that changed my life. But in particular, I asked him 2 questions. And I want you to answer what you think his answer was. But you've got to do this with some energy, okay, and commitment to your answer. Is that clear? All right. So first question I asked him, do you have enough food in your food bank? And his answer was? No. Very good. Low on the energy, we'll have to for the next question. Second question, if we captured all the food that is normally thrown out, could we end hunger? Yes. Then why aren't we doing it? Then why are we not doing it? So, I now have a new idea. I'm going to end hunger in Orange County. So I returned to Orange County and I knock on my boss's door. And I walked in and I said, "Mark Grefowitz, the director, I've got a new project." I said, "I'm going to end hunger in Orange County." You know what he did? Didn't laugh. He patted me on the shoulder and he says, "That's really nice, Dr. Hammer." I could have said, "I want world peace," and he would have given me the same response. This is a true story. His other comment was, "We're not a social services agency." And I went, oh my goodness, the learning curve is going to be steep. But he's now our biggest supporter and our biggest fan. So remember I told you, most political requires passionate, dedicated people. And we did this on a shoestring budget. 3 things that I want you to keep in mind. Next slide. This is what our website looks like. It's called Waste.OC, Feed the Need. Just giving you an idea, all the information, if you go to About Us and click on that, you'll see videos, all the videos that I'm showing you and all the information. We even have a toolkit for how you could implement this. All right, next. This is Orange County's statistic. 12.7% of the households are food insecure. Almost 350,000 people don't know where their next meal is going to come from. 1 out of 5 children don't know where their next meal is going to come from. Basically, they're hungry. That's the bottom line. We're just calling it food insecurity. Next, please. All right. This is child poverty rates in California counties. Orange County is 18.4%. I want you to look at this. I want you to read through this. And if something sticks out to you, a county with a rate, yell it out. Wait, loud. Go. What was Merced? 40%. What else? Loud. What is Sacramento? 25.2% is the childhood poverty rate in Sacramento. What else?
San Mateo,
How much?
8.6.
That's good, huh?
Well, it's a lot better. So
Probably have no children. Okay. Anything else stick out?
Santa Barbara.
Huh?
Santa Barbara.
How much?
19.
It's amazing, isn't it? Now here's the real claim to fame. Next slide. You'll love this. Orange County ranks one of the top 10 counties in the nation with the highest number of people facing food insecurity. No one, I can tell you, no one knows this. And when I started this journey, I didn't know this. But look at this. Next. We all know about the child impacts of food insecurity. This is a great slide because it talks about headaches, iron deficiency anemia, upper respiratory infections, stomach aches. So, what's your name?
my name?
Yes.
Sandy.
Did you have children?
No.
Okay. I'm going to pick on somebody else then. Who has children? Raise your hand. Well, we're going to go on back. Come on up here. Don't be shy. And who are you? What's that?
I'm not shy, I'm just standing.
Jill. So Jill, How many children do you have?
3 boys.
3 boys. So let's say you have 3 boys and not,
Sometimes 4, sometimes 5.
you're probably lucky not having the children. I'm just letting, okay, that's a lot better. So let's say your kids are in middle school, your children, and they're hungry. Tell me what the impact will be in that classroom.
Poor attention, unruly, poor attention, not completing the work. And speaking from experience, even though my kids.
But isn't that true? So that teacher looks like a banana. The whole time they're teaching, they look like a banana. But you know what's interesting? I just read an article that stress in childhood leads to stress into adulthood that is then passed genetically to the next generation. And we do nothing about this. When I say we, it's the big W, right? We do nothing. All right, next. By the way, you did very well on that. Your first name is? Jill. You get a wristband. And Dante, you get a wristband. Okay. All right. So what makes our program unique is it's 3 steps. Getting restaurants or grocery stores to donate food, identify people who need the food, and get them to the places where the food is. Easy formula, right? Okay, next. This is something that I don't think Dante knows about this one. Look at this. The health and safety, Dante, the health and safety code that we work under as health officers. Dante, read that for me, buddy.
The county health officer designated nonprofit food distribution agency to coordinate and facilitate the donation of food and food products to nonprofit charitable corporations from available sources, including restaurants, grocery stores, or food distributors.
Who knew that? It's part of my job. I didn't know that. It's part of the public health officer's job in California to facilitate this. No one knows that. Next, please. All right, so here's what we did. Now we start getting into the beef of the story and the politics and all this kind of stuff. I knew in order for this to be successful, I needed to recruit environmental health specialists who do restaurant inspections to help me get the word out. So I went to the director of environmental health and I said, "Can you help me?" And he looked at me and he said, "Dr. Handler, we're regulatory and we have to stay in our lane." I went, "Oh no." But he actually had a point. Let's say we have 15,000 restaurants in Orange County, and let's say a restaurant inspector goes, "I'm going to inspect your restaurant." By the way, do you do food donations? If you're a restaurant owner, what's going through your head? If I answer, what is going through my head?
What's the right answer?
What's the right answer? So if I say yes, maybe I'll get a good grade.
Or if you answer yes, you're now liable for another set of bills.
Exactly. So there is some point to it. But their role is also to educate, is it not? So how do you overcome bureaucracy, politics? You find an internal champion. That's the most important thing. So I found an internal champion. The director of the food safety program in Orange County, Mike Haller. Not only was he an internal champion, watch what he developed. Next slide. Hopefully this won't shake. There we go. Remember this video. If anybody tells you they can't donate food. Can we hit the lights, please?
I'm a food inspector here with the food safety program at Orange County Environmental Health. We are the
And can we increase the volume too, sir?
15,000 food facility inspections.
Okay.
And they include proper hand washing, food temperature checks, and overall sanitation. But I'm here today to talk to you about another subject. That is food hunger and food insecurity here within Orange County. Now this topic may not seem related to what you think a health inspector does, but the same laws that govern regarding the donation of food products and the safety of expired food. We here at the Food Safety Program, to show our commitment to the worthwhile cause of facilities donating food products, have partnered with our friends at Food Finders, Second Harvest, and the Orange County Food Bank, various food facility operators, both big and small, all with one goal in mind: ending hunger and food insecurity in Orange County. We are proud of the coalition we have formed with these groups, officially calling ourselves Waste Not OC. So now you've heard it from a real live health inspector. Donating food is not just okay, we encourage it. It is good for the individuals in need. It is good for diverting food products away from our landfills. And in general, I think it just makes you feel good that you are making a difference in people's lives. So let's make a difference. Join our team and feed the need.
All of this was done by students. They just did the videos, okay? Hit the lights for me, please. So, they gave, in November of 2014, I brought all the people from the food industry together. And I asked them, why are they not donating food? They gave me 2 reasons. They gave me liability. Is that what you said? You get a thing. What was the second reason? No. What's that? No. The health department won't allow us to do it. Another reason for having environmental health go out and talk about it. They developed a 1-page form that when they go out and do restaurant inspections, they said, you're not held liable under the Bill Emerson Good Samaritan Act. That's a federal law. No one knows this. Or if they do know it, they say, well, maybe it's a little bit too much trouble to donate, right? Not true. Internal champion will help you get to where you need to get to.
That law's on your webpage?
What's that?
That law's on your webpage?
Yes, ma'am. You don't even have to take notes, you just have to listen. Next, please. All right, now look. Remember I talked about social determinants of health? I'm just one person. Okay, I'm the public health officer, so what? I can get people into the room, so what? Somebody has to dip their toe in the ocean to start the ripple effect. So we decided to target 2 cities, Anaheim and Orange County. But the really cool thing is, you see this thing on the right? A graphic design firm developed that and gave it to us for free. If you are a participant and a supporter of Waste Not OC, you get that seal. People are clamoring for that seal. But here's the best part of all this. Dipping your toe in the ocean, look what it created. Next slide, please. You want to read that out loud for me?
July 2014 to present, targeting the cities of Anaheim and Orange, 280 tons, almost 400,066,637 meals of newly recovered food.
Look at that. And that's just dipping the toe in the ocean. So I don't want to hear anybody say there is an issue that's too big, that you can't do something about. Look at this, 280 tons. That went to people that were hungry. Nice job, by the way. You get a wristband. You're welcome. All right. So next slide. So I gave a presentation in Orlando, national presentation. Northgate Market is there. They have markets throughout Orange County. They came up to me afterwards. They said, Dr. Handler, we want to help your cause. I go, okay. I get a phone call from them. They go, we want to donate 70,000 pounds of food from a warehouse. And I went, okay, is that over 6 months? Is that over a year? They go, right now. So Second Harvest truck, Food Finders truck, OC Food Bank all came and took the food. Now, one of the things that I've always am just amazed about is people go, well, what about expired food? They have expired dates on it. Means absolutely nothing. So I'm going to help you out here. I found a great app, next slide, called Food Keeper. It is a free app. This one you can write down. You go to your app store, download it, and any food, it will tell you how long you can keep it before it expires. And it has all these. Baby food is the kicker that you have to be careful about. It has baked goods, beverages, condiments, dairy products. You click on it, click on what it is, and it tells you how long. So the expiration date means absolutely nothing. Okay, next, please. All right. Any physicians here? Any nurses, healthcare providers? Okay. Uh-oh. She didn't look at me. She just raised her hand. You want to stand up for me?
The nurse manager for Brand One program.
Okay. So not to put her on the spot. In your training, have you ever asked a family if they faced food insecurity?
In my training, no.
Why not?
Why not? I think there were other priorities, other defined priorities.
Okay, that was very good.
Yes.
You got yourself, wow, you got yourself out of that one. So, I've been a practicing pediatrician for over 30 years. Never, ever asked any family if they were facing food insecurity. Right? Never. Why is that, everybody? Why did I not, thank you. Why did I not, yes?
Well, you have a list, as you said, of priorities that you've got to tick off in a matter of 15, 30-minute appointment. And so you have, again, the diabetes, the hypertension. But as we learned the last speaker series, those things are informed by food insecurity. So.
And who are you? What do you do, Dante?
I'm Dante, again. And I'm a research scientist.
Okay. So there are other priorities. You were going to introduce yourself.
Brian Howe with United Way. I think the hospital prevents you from asking those types of questions
Why does it prevent you?
because of liability. I mean, and then you have to ask follow-up questions, and you're not having to.
So it's a pain, isn't it? Go ahead. Thanks.
Something about your coding of how you get paid. You don't get paid for the preventative questions and the screening and things like that. So, and I know some of that has changed along
How
the
much
way.
time do I spend with a pediatric patient?
Very little.
15 minutes.
15 minutes. Are you going to tell me I have to ask more questions about food insecurity? What were you going to say? There was somebody who was going to make a comment? Yes.
It's just uncomfortable to ask.
Oh, I love that. You know, that always comes up. Okay, let's just try this a little bit differently. How many people know people or themselves that were food insecure? Raise your hand. Looking around the room, it almost touches everybody. Here's my point. In my career of doing this, it's not me, it's not the person who's receiving the question that's uncomfortable. It's the one who's delivering it. I'm uncomfortable. All right? So, but if I ask the question and they say yes, what am I supposed to do? That's the other part, right? So let me tell you what happened. I met with Children's Hospital of Orange County. The CEO and everybody was very supportive, but it wasn't necessarily a high priority. Okay? I made presentations to the nurses to say, I want 2 questions to be asked. One of the nurses raised her hand, and she goes, Dr. Hamlet, I think it's intrusive to ask 2 questions about food insecurity. And I looked at her and I go, okay, so you have a 15-year-old young man come into your clinic and you go, are you sexually active? Do you have multiple partners? Are you doing drugs and alcohol? What are your positions? Give me all this information. That's intrusive. Not asking, are you facing food insecurity? Next slide. So all you have to do is ask 2 questions. That's all you have to do. Could you do me the honor of reading that, please?
Well, I don't have my glasses on.
Okay, then, all right. Can you read it for us?
Certainly. A screening tool to determine level of food insecurity. Within the past
Yeah, this is very intrusive, right? So, it took me a year to get Children's Hospital of Orange County to start asking the question. The way I accomplished it, I had lunch with an internal champion, a physician, who made it happen within 2 weeks. They've screened over 33,000 inpatients asking that question. Never has it been done before. Next slide. All right, so before we show this, I'm going to give you a couple, I'm breaking this up with videos and stuff like that, so just stay with me. So when I give presentations to small groups, what I like doing is asking them to tell me who they are and then share something about themselves that most people don't know. So I gave a presentation to Sysco, S-Y-S-C-O, their distributors of food, and there were about 15 general managers in the room, and I asked that question. And I get to this gentleman, Art Jimenez, and he looks at me and he says, my family and I were put into a Tijuana jail 3 times. Okay, next person. What am I supposed to say to that? What am I supposed to say to them? So, after our presentation, I went up to him and I said, what was that all about? He said, when we were very young, we tried crossing the border to get into California, and we got arrested. Eventually, we made it. Eventually, we were able to get into California, and we became citizens. And I said, would you like to share your story? And he said, certainly. And so this is his story. But what I want you to do, as he's telling his story, look into his eyes and watch his facial expressions when he talks about being a kid. All right.
I was born in Mexico City. My family and I moved to the United States shortly after the 1988 Mexico City earthquake. We moved here when I was 8 years old at the time. We quickly assimilated into the rotation of soup kitchens, is what I recall. You know, we had, okay, on Mondays it was so-and-so place in Garden Grove, on Tuesdays it was over here, on Wednesdays it was this. All the while, you know, the adults in the group, my mom, my extended family, very, very proud, right? My mom, always very proud that she never got $1 from welfare. You know, meanwhile, I would work 2 jobs. I mean, she worked at McDonald's, at Burger King, and at one point she actually worked a graveyard shift at Bridgeford Foods. So, you know, the whole it takes a village thing, right? I mean, my grandmother, my extended family, was the one that we were blessed enough to be able to live. Given the strenuous and difficult conditions we lived in, the advantage to it was that we all were there together. So while one of them was working, there was at least always someone there to tend to the kids. You know, I mean, there was even times when we would go to the back of grocery stores to seek out food. In particular, you know, the Ralphs in Villa Park. We always knew that's the one that just had the primo, you know, really good product. Moral of the story, you know, hungry people find a way to feed themselves. One of the places we went to was St. Michael's in Fullerton. One of the times I was in line, I was going down the line, getting fed at one of the soup kitchens, and across the way, you know, somebody says, "Oh, is that you?" And I look up, and it's this boy who was in my class. And at the time, I was being bused to a different school that was out of my school district because I was part of this. I was identified as a part of this GATE program, Gifted and Talented Education. So I was attending school in an area that was very affluent, very, very, very different than the area I lived in. And I was aware of that. I was very keenly aware of the fact that these children around me are not like me. They're very different in many ways. And yet, why that memory and why that experience of this one time with this child, with this classmate, was so impactful is because it was this this odd, almost divine understanding where he never said a thing about it, never teased me about it, never said anything else about it to the kids in class. And as I think about it now, I can almost, it comes back again, the flush face, the moment of, oh my gosh, now you know that I'm poor, you know. But he just smiled at me, and it never became an issue. So, yes, it was uncomfortable, but more uncomfortable, the reason I share that story is this, more uncomfortable would have been, you know what, I'm not going to go eat there anymore because I can't get over my issues with it. I gotta eat. And the hope is that people's hearts are in the right place, like this 12-year-old, 13-year-old kid was at the time. Because of that kid who put the gravy on my mashed potatoes, because of Salvation Army Christmas we have, because of this and this and this, in spite of the bleak, horrific things I went through, I'm happier than I've ever been. And I consider myself a fairly successful person in business. And it's all just the cumulative result of all those things.
Why did he do this? This general manager of Cisco from Los Angeles? Why did he do this? To show it can happen to anyone? Absolutely. Did you see in his eyes he was that kid again going through that line? Somebody else had a comment?
Well, that's what I was going to say. He wanted to show that, being in poverty is something not to be ashamed of. Sometimes you have to take ownership of it, and whatever we do to help. Thanks, us to start.
Go ahead. Thanks.
It actually made me really sad because when I was in junior high school, I lived in Compton, and I remember that there was a long line that would go into the cafeteria to feed kids for free, and the kids who would stand in that line would get teased miserably. And so most of the kids would not stand in that line. They wouldn't do it.
Yes.
This is one of the things that needs to be done is more public service type of announcements, normalizing, food stamps, whatever, whatever, having people that are successful, telling their story so that there's not a stigma.
Putting a face to the problem is what you're saying. Was there another comment here? Okay, so again, let me talk to you about dipping the toe in the ocean. So there's two questions. It's been proven that these are valid questions. So I said, I know that the American Academy of Pediatrics has an annual meeting every year where people are allowed to put resolutions in, and they choose out of 230 resolutions, top 10 that will set the stage for the following year. So I go, what the heck? I'm going to put those two questions in and say we should be asking those questions about food insecurity, right? So, next slide. Next slide. Look what made the top 10. Number 7, universal screening for hunger, food insecurity during office visits. Who would have guessed? But it made it on the national scene. And they came out in October of 2015 with a policy regarding hunger and ending hunger. Can you go back one, please? These are our partners that we have with Wasteland OC, Children's Hospital we talked about. We have family resource centers, 15 throughout Orange County. They ask if you qualify for food stamps, all kinds of questions. They are asking the two questions. We got the whole county covered now, making sure that we identify people in need. Anaheim School District is donating food. Hospitals are. Theo Lacey is a jail. I found an internal champion within the jail. You want to talk about politics and you want to talk about all kinds of stuff, bureaucracy, this champion is now in a more prominent role. He's going to have all the jails donating food. Never happened before. Next, please. And next. So here's the cool thing for all of you to know in California. This is something that you have to put in your memory bank. There is a new bill that's been signed into law that took effect in April of 2016 called AB 1826. And it addresses the issue of landfills. AB 1826 plans to reduce landfill waste by 50%. By 2020, you need to do this. If not, you will be penalized. There are 3 ways to decrease the landfill: compost, anaerobic digestion, and food donations. Major trash haulers are saying donate food as the number 1 priority. Next, please. And next. So, all right, so I always tell this story. There's a student by the name of Shaw Steiner. He was getting his MPH. He came into my office and he goes, I need to put 240 hours of community service to get my final degree. And I said, Shaw, first time I met him, I said, okay, I got a project for you. He goes, okay, Handler, what is it? And I said, we're going to end hunger. And he's there, stone-faced, absolutely stone-faced. And I said, Shaw, what's the problem? He goes, I only have 240 hours. True story. I said, but we got to start somewhere, Shaw. And one day he called me into his office that he was working, and he did something really remarkable. He developed a Google map of all the food pantries. You put in your zip code, and it tells you the nearest pantry to go, too. So when you ask the question now, you have a way of helping them out. Remember I told you the 3-prong approach? Increase food donations, identify people who need the food, and get them to the food source. And if you click on a pin, look at all the information. There's there. I now have 3 students this summer who are going to all 240 pantries to validate the information. Okay, next please. I don't know if you're familiar with this tool. It's called healthycity.org. But it has all kinds of demographic information, food information. It's just a great website, and it's only based in California. But it gives you a profile, countywide and citywide. You can go to zip code. Next, please. So we've had a lot of support. Remember I said this is on the shoestring? United Way has given us 2 years now, and we're going into our 3rd year where they've given us $50,000. Remember Mark Brefowitz, who said we were not a social services agency? He supported a project manager part-time. Everybody who has worked for us has been students. Our current project manager is a student, senior in the university, and another one's getting their MBA, all on a shoestring. So 211 OC has taken our Google map and put it into their website, right? Simple solution, right? Because you could go to 211 OC, find out about jobs, housing, all kinds of things. National recognition, all those acronyms. As a matter of fact, I just got back from New Haven, Connecticut last week. They want to replicate what we're doing. Austin, Texas wants to replicate what we're doing. San Bernardino, San Diego, LA County, Alameda, all want to replicate. So let's take a moment. Remember I said it's the most political, shoestring, passionate people, right? But there's one other factor. It's magical. And I'm going to prove it to you. Every day something magical happens with this campaign. LA County called me up and they said, can you present to our agency on Waste Not OC? And what I'm about to tell you is a true story. I walk into the offices in LA County and there are 5 people there from the agency, and there's one gentleman to the side. Turns out to be a philanthropist that I never met before in my life. So we're having this discussion about working with the restaurants to do donations, and he goes, Dr. Handler. I go, yeah? He goes, I don't understand why restaurants aren't doing donations. It benefits the society. They get a tax benefit write-off. Why aren't they doing it? And I said, I don't know the answer to that, but I said, I bet you can't get this corporation, which I won't mention, to donate food. He stood up. He's 6'4", probably 300 pounds, and he walks up to me and he says, I bet you I can. And I go, oh. He shook my hand and he said, I bet you $2 that I can do it. Remember I told you he's a philanthropist. I go, okay, I'm not going to argue with you. At the end of the presentation, and I'm saying goodbye to everybody, he shakes my hand, and there's a piece of paper in there. He gave me $99,998. It was a check. Why wasn't it $100,000? $2 bet. I was going to lose that $2. I have never in my life received a check like that. He said, you guys are doing such incredible work. Get the word out. He says, I give all kinds of donations. He said, this is one cause I think that's so important. I walked out with that check and I go, this is magical. Absolutely magical. That's why it's so much fun to get this happening. Okay. Next one, please. All right. We've got a very talented group here. We're moving along here. We're almost done. Late night pickup. All right. There's a call at 11:30 on a Saturday night saying, we've got some food we want picked up and donated. Who's going to do it? Who are you going to call? Uber. What did you say? Uber. Okay, that's not a bad idea. Would you call a college student?
Sure.
Okay, let's review this. 11:30 Saturday night. Okay, how many with show of hands would call a college student at that time? No, I don't. No hands there.
That's why you have to go for the A.
Huh?
That's why you have to go for the A+ student.
That's right. The
They're
A
gonna
plus
be the ones that-
sobriety is an issue. Okay. Next slide. Yellow cab. So again, point number 4. It's magical. We met with Yellow Cab and they said, can you help us out? They go, we will help you on late night pickups. We'll put $500 on the table. You call dispatch, you tell them where it needs to be taken, where it needs to be picked up, and we'll do it. But that's not the magical part. We'll take your seal and put it into every one of our cabs. All 530 cabs. Now they have our seal to get the word out. Okay. Anybody here taken a drama class? We're going to come on up here. Oh, did you hear what she said? Oh, I have to get up here? I've been up here almost an hour. Come on. I'm not complaining. Look. Oh, if I knew it was going to be this big a deal. So